program today. I'm extremely happy to introduce to you Dr. Punnoose Sam. It's an special occasion I feel for me because Dr. Punnoose Sam, I would not like to introduce him as just a doctor. He's one of the closest friends. I'm very happy to introduce him because today he has proved what he wanted to become, and thus he becomes an example for each one of you, the young homeopaths going to be, and many of you, the practitioners who have just started your practice also. Regarding Punnoose Sam, I need not prepare a introduction. Neither he has given me one, because if my BHMS whole of 5.5 years of study, I don't have a single day of memory where an imprint of Dr. Punnoose Sam is not there. It's every day of my 5.5 years is where at least something, a reference for Dr. Punnoose Sam is there, because he was my not only a batchmate, initially was a neighbor in the hostel, then he became a roommate for next many years of our study. Right from that day, maybe 1991, till date, Dr. Punnoose has remained same in his spirit. He was very well known as a loving, charming character in the college. He had a very beautiful smile. Even now he has got it. It's nice to see him. He had a very big dreams. His father was a priest who was roaming all around the world, and mother gynecologist. Initially she was working in South Africa, and later on she set up her own nursing home in Punnoose, Kerala. Punnoose and the place Punnoose, they go so well, hand in hand. So from there, he said, he always used to say, I wanted to go to Australia. The reason was, Australia is one country where I don't have relatives and I want to establish there. I want to establish on my own. Today, he has proved it. He has done his PHMS here in Father Mullas along with us. Then he did his PGDHA, and now he is a well-established practitioner in Australia. But he has not remained complacent with his practice. He is the founding director of Global Homeopathic Foundation, Australia, and he has attained Homeopathic Physicians Recognition Award for continued medical education from Homeopathic Medical USA Association. It is a small just glimpse of what he's doing. He's still got dreams. He says, we have to establish the system in Australia. You know, it's how difficult it is, but he's determined. A big group from India is backing up. He's got the support of very well-renowned allopath, turned homeopathy in Australia. They are into research work. It's really very heartening to see him, not only just as a practitioner, but really aiming high and dreaming high. I'm so happy to be a part of, just to be involved with his activities. He's got his wife and 2 children, very beautiful 2 children, I think Eva and Angela. Eva and Angela. Dr. Punnoose is today will stimulate you with a thought-provoking a talk on sinusitis. I think he is doing a lot of work even in autism cases. Probably in some other day we'll see that. So I request Dr. Punnoose Sam to take over the session.
Thank you. Thank you, Dr. Praveen Raj, for that wonderful introduction of myself. Really, I'm indebted to you. And you just you pulled me off into my memory lanes 25 years back, 1991 to 1997. Thank you, Dr. Praveen Raj. That was a warm welcome that you gave me. And yes, as you said, I do cherish the wonderful days that we had while studies, and with all the struggles that we had during our studies and the achievements that we could make. And I'm really impressed, as I'd just viewed the short video that you had displayed earlier. I was very impressed to see the Alva's Homeopathic Medical College that has been so well established, with the management, spending so much of resources into supporting the system of homeopathic medicine, and the education along with that is being transformed into a great establishment, like what I just saw now. I'm impressed that you are very much into research and into quality education for the upcoming homeopathic doctors. Yes, our fraternity, homeopathic fraternity, really requires very much research-oriented and academically qualified, serious, passionate homeopaths. And I'm sure with the able guidance and teaching of Dr. Praveen Raj, as I know him from his student lifetime itself, he was one of the excellent students which Father Mullers had seen. So with him and Dr. Roshan Pinto and all the teachers that are really helping the young homeopaths to come up in the right direction, I'm sure that Alva's Homeopathic Medical College is going to have a great future and a great, is going to make a landmark in homeopathic history. Saying that, I would like to thank Manish and his team in the Students' Union of giving me this opportunity to share this particular presentation in front of you. I was in fact wanting to do something else, something different, but just for the sake of asking what Manish would like me to share, and he brought up this particular subject, which is sinusitis and its homeopathic management. I was on the desire to just share the knowledge and share the experience that I had with vaccinosis, which is being seen quite frequently most of the days in my clinic, where kids come with autism and ADD and ADHD, very much where the vaccinosis is how I've seen it and how they have come and presented. So I was on the desire to do that, but as Dr. Praveen Raj said, we could do that at a later stage. But today, lo and behold, I started my practice in Australia with one of the beautiful cases that I got in sinusitis. So it so happens that Manish picks up the best of my successes that I had, and I would say one of these cases in the initial start of my clinic in Australia brought more patients to me out of the success that I got in this particular case that I'm going to be presenting to you. I would not be presenting too many cases. I wanted to, but due to the limitation of time, I've just condensed all the cases, and I've found out what medicines have been so effective for me in the treatment of sinusitis. And I've just put it on a chart form for you guys. So saying that, with all your permission, I would like to start off my small presentation on sinusitis. Now, let us see what a sinus is. Sinus, as we know, it is just a hollow space in the body. Now, our point of concern is the paranasal sinuses, because when we say sinusitis, though it is the infection or the inflammatory process of every sinus, we normally say about sinusitis for the paranasal sinuses. So we are going to be discussing about the paranasal sinuses for today's presentation. And as you would know, you guys being very well educated, very well trained in anatomy, physiology, and surgery, I'm sure that you guys would be able to click straight away into what I'm saying, and then we could just keep going. Now we've got the four pairs of sinuses, paranasal sinuses in our body, as you all know, which are bilaterally. We have the maxillary sinus on either side of the nose, on our cheekbones, and then we've got the frontal bilateral sinuses, which are just above the eyes, and we've got 3 to 4 small pairs of ethmoid sinuses, which are either side of the bridge of the nose, near the eyes, and also the sphenoid just behind the eyes, deeper into the skull. Why I just gave you an idea is just to have a quick. I'll just show a picture as well after this. But I would like to ask. I would like to throw a bit of a light into the relevance of the need of sinuses. Most of the time, when we've got some infections, and when we've been, most of the times, the advice that comes up is, you got a tonsillitis. Oh, that is happening too many times. Let's take the tonsils off. Or else, if you've got an adenoids, if it's slightly enlarged than what it is, and it's causing some issues, let's take the adenoids off. The same with the appendix. And even some, I shouldn't be saying any particular person who advises it, but I'm sure you guys would know. Some would advise, let's do a sinus surgery. And sometimes that ends up in great catastrophe. So let's just have an idea. Why do we need to have why do we need to have these sinuses? Same like, why do we need the appendix? Some say there's no need of an appendix, it's just a vestigial organ. But now researchers have started saying that no, we needed the appendix there, because when we've got a very bad diarrhea, or we've got an infective process happening in the gut, and we've gone in for a total loss of the microbiome of the gut, the bacteria in the appendix is what suffices the lack of microbiome or the lack of the bacteria in the gut. So when we are on a strong antibiotic therapy for maybe 1 or 2 courses of it, the normal bacterial flora could be lost. So that is when we've got the appendix, which holds the bacteria, the healthy bacteria for our microbiome to be healthy, which supplies the sufficient amount of it. Whereas if you take it off, you know the end result of it. It's the same with the sinuses. Now let's know what are the need of the sinuses. The sinuses help in the voice, our voice to resonate, and it helps as the air vibrates. It helps in the production of the voice and the resonance of the voice. The sinuses help protect your face in case of a trauma. It also insulates against rapid temperature changes in the nose. It humidifies the air that we breathe in with the mucus secretion and the ciliary action of the lining epithelium, which purifies the air that comes in. See, so there's so many functions, and of all the important function of the sinuses is to provide as an immunological defense. So any Tom, Dick, and Harry in the form of viruses can't enter into our system with this beautiful sinuses being insulated, working as an insulation with all the ciliary cilia, as well as the mucus secretion that comes from the epithelium. How marvelous is the sinus, and that's how we've been created for, in that 9 months of period of gestation in the mother's womb. We've been created fearfully and wonderfully with every part of the organ of our body essential, and nothing is by mistake a waste or of no need. So let's go to the next slide, which I would like to tell you about the sinuses. As I was saying, I would just like to, you guys would be knowing all of that, but just to throw a little bit of idea or throw a bit of light into the sinuses. We see the frontal sinus up there, and we've got the sphenoidal sinus. We've got the maxillary sinus and the connection that we see here as the eustachian tube. Now, what are the important relations of the sphenoidal air sinus? The sphenoidal air sinus has quite a good amount of anatomical importance. As we said, again, everything is in our body for a particular reason. So the important relations as we see on the slide for the sphenoidal air sinuses are as follows. The superiorly, we've got the optic chiasma and the pituitary gland. And the laterally on either side, we've got the cavernous sinus and the internal carotid artery. And inferiorly in the bottom part, we've got the roof of the nasopharynx. And posteriorly, we've got the pons and the medulla oblongata. Anteriorly, we've got the sphenoethmoidal recess. As you can see, when we've got a pituitary gland resection, they normally go through the sphenoidal, transsphenoidal, route to go and get the pituitary gland out of our body. So all this shows that every part of our body is important, and that is what the sinuses are meant to do. Now, the lining of the nose and the paranasal sinuses is continuous, and the inflammation and any inflammation which affects the lining of the nose will spread to a variable extent into the sinuses. An inflammatory process that is primarily cited in the sinuses will in turn extend to the nasal cavity and result in variable amount of rhinitis. Most conditions in the nose, therefore, affect both the nasal cavity and the sinuses, and that is why it is called as rhinosinusitis. Now, the acute sinusitis is defined as an infection of the nose which has spread to the paranasal sinuses within a duration of between 1 day to 3 weeks of time. Now, what about chronic sinusitis? It is defined as a patient having 2 or more of the symptoms like the nasal obstruction, rhinorrhea, facial pain, headache, or anosmia for no longer than 3 months. The treatment of chronic sinusitis is different from the acute sinusitis. Now, along with the sinusitis, we will have to look at certain complaints that assist the sinusitis. As we said, the tonsillitis, the recurrent tonsillitis could assist in the formation of sinusitis. Similarly with adenoids and the nasal polyps and the common cold and allergic rhinitis. Now let's look at the pathogenesis and the clinical features of acute sinusitis and chronic sinusitis. Acute sinusitis, as you know, it usually follows an acute upper respiratory tract infection. We call it as common cold. As the viral infection spreads in the nasal mucosa, swelling and edema of the mucosa results. As the mucosal surfaces of the osteomeatal unit are in close proximity to one another, the obstruction of the sinus ostia happens. And in addition, the viral infection may also reduce the normal ciliary motility. This prevents the normal mucociliary clearance, resulting in an accumulation of mucus in the sinuses and the development of symptoms of sinusitis. If this mucus becomes secondarily infected by bacteria, acute bacterial sinusitis could develop. Now, let's look at what we can do as homeopaths. Now, most of the time we get acute sinusitis, but mainly we get chronic sinusitis because most of the time the patients would have tried different regimens, different measures to help them in an immediate acute form, and then we get the chronic state of the sinusitis. Now let's see how we will have to deal with a chronic case of sinusitis. The ideal steps that we should be taking is case taking, as you know. And as we all know, a well taken case is half cured. So we'll have to take a well elaborate case, and then we need to get into recording and interpreting that the well taken case. What is to be treated in that case? What is the crux of the case? What is the centrality of the case? Now, and then we need to classify and evaluate the symptoms into common symptoms of sinusitis and the uncommon peculiar symptoms which are not there in sinusitis. Then is our step of defining the problem and also in erecting the totality. We could use repertorial method, or we can go for a non-repertorial totality formation also. I would be showing you one repertorial method as just one of the cases that I've explained. Now, in the treatment and management with the acute or the specific treatment, as we said, most of the time we get the chronic state of the complaint, but at times there could be acute exacerbations of the chronic complaint of sinusitis. So in that cases, what we do, what I have found to be effective and what I've seen and what I've been taught by my masters are to find the thirst of the patient, find the appetite, assess the taste, the smell, the sleep, and the sides of the affection of the complaint and the sensations that the patient has during that particular acute presentation of the complaint. So when we have these many points, we don't need to take an elaborate case, but with these points where we've checked out on the thirst of the person at that particular time, the appetite, the taste that the person experiences, and the smell, the sleep, and the side of affection with the sensations, what the person experiences at that time, we would be able to get an acute totality. Now, I would also show you how I have derived the acute totality in the case that I'm going to be explaining very soon. Now, how do we go for chronic totality? As we said, most of our cases would be on the chronic state. So let's follow these 5 or 6 steps. If you're doing a repertorial, well, let's take the repertorial step as well. So taking a well-taken case, recording and interpreting it, and then classifying the symptoms into common and uncommon symptoms, defining the problem, and bringing up a totality. Now, we know the best way of treating any complaint in homeopathy, and the beauty of homeopathy is going constitutional. So I would recommend my friends to try to aim at getting the constitution of the person and getting a chronic totality of the person. And the second most important method of treating a chronic case of sinusitis is understanding the miasm of the patient, because we would require that anti-miasmatic intercurrent remedy ready at any time to introduce, if in case, as you know, when there is a status quo in the improvement of the constitutional therapy, or if the constitutional therapy which we have selected has not impacted at all. So that is when we introduce the anti-miasmatic or intercurrent remedy. Now, let's just look at some remedies that what I've seen normally helpful in the acute state of the complaint. The first remedy that comes up is as ammoniacum dorema, which has been found specific for the frontal sinusitis. It also is helpful in chronic bronchitis, as well as the sensation that we see in this ammoniacum durema is we feel a burning sensation and a scratching in the feeling in the esophagus. So, and there is a difficulty in breathing with a dry throat. And most of the time fresh air, when we inhale fresh air, there is that burning that comes up, and there is that difficulty in the throat. So in that case, I found ammoniacum durema very effective. The second one, which equally comes up for frontal sinusitis, is iodine. As with all the adenoid involvements and they have been asked for adenoidectomy, iodine does a very good job in helping, getting the adenoids reduce in size, as well as helping in the frontal sinusitis. Iodine is also indicated for acute upper respiratory tract infection, which leads to the right lobal pneumonia. Now, here in iodine, we see that there is fluent hot coryza. It is said that iodine is warm, though it loses flesh with that ravenous appetite. The iodine is a warm person, and anything warm aggravates the person. And there is a marked debility with the slightest work, which brings up profuse perspiration. Now, the third remedy that has helped me much is Calibic chromicum, which has been found to be helpful for both frontal and maxillary sinuses. And as the characteristic features that we normally say, with the tough, stringy discharges, and also the elastic plugs that come from the nose and the postnasal drips that we get. Also, it helps in anosmia. So when we speak about the present situation where we are all battling with the COVID-19 pandemic, sinusitis is one of the presentations where COVID comes up with, and Calibic, along with bryonia and arsenic album and gelsemium and even camphor, has been found to be very effective because of that. This particular symptom, that important symptom that is one of the clinical features of COVID. Plus, if you've got the tough, stringent mucus, we can definitely think about Calibic. Now, the next remedy that I would like to discuss is hydrastis. With the characteristic of hydrastis is whenever you've got some sort of complaints, the constipation is one of the complaints that is being seen accompanying with the frontal sinusitis in our point of study. But in other conditions where the hydrastis gets indicated, the constipation is something which we should look for as an accompaniment. Now, in hydrastis, we've got the post-coryzal sinusitis, watery to thick excoriating discharge, and very similar to Calibic, there is that tenacious postnasal discharge with a bitter, peppery taste. And very much like Merck sole, we've got the hydrastis patient would have the imprint of the tongue, imprint of the teeth on the tongue, very much similar to Merck sole. Now, another remedy which I've found very effective, and I've been discussing upon one of the cases that I've come up today, which I'm discussing, is Spigelia. Spigelia is indicated for the frontal sinusitis with pain in the temples, which extends to the eyes, similar to the onosmodium. But the sensation as if a band around the head with the ciliary neuralgia is one of the very key features of Spigelia. And there would be photophobia as well. Now, the HEPA self is also very effective. It is effective for hay fever, and all the catarrhal congestions with the smell of old cheese, and boring of the pain into the right temple and the root of the nose, and all the aggravatory factors like the morning aggravation, the exposure to cold wind, and shaking of the head or riding in a carriage, all that brings up pain in HEPA self. And also HEPA self reports about vertigo during this particular complaint. Now let's come to the miasmatic background of sinusitis. So as we said earlier, we need to know what miasm each state of the sinusitis is. Once we know that, anytime we've come across a status quo of the improvement, we could introduce an anti-miasmatic remedy. So what I've seen is in Sora, and as you know, aconite, sulfur, the usual antisoric remedies like sulfur, soranum, natmur have come very effective. Miasm, thuja, sepia, medorinum. And in tubercular, we've got the best of the best, which is tabov, basilinum, and the iodine, which I mentioned earlier, HEPA self and pulsatilla. Now, syphilis, most of the times, the end part of, as you know, the end part of any condition would be the syphilitic miasm, where there is any changes in the structure of the sinus, and if there is any calcification or any deterioration of the sinuses and the bones, we could think about syphilis. And the indicated remedies that have been found very effective are the Merck salt, Merck iod, nitric acid, fluoric acid, kali iod. Now, in the chronic treatment, these are the important remedies that have come in my practice. As I said, I was just looking at about 20 to 30 cases, which for this particular diagnosis, and most of the constitutional treatments that have come up were natmu, lycopodium, phosphorus, pulsatilla, nitric acid, and fluoric acid. Saying that, my fellow homeopaths, my counterparts, would find some other constitutional remedies as well, but these are the remedies that have found to be effective and found to be more prevalent in my practice in sinusitis. Now, we're coming towards the management of sinusitis. I prefer to go, though we are just discussing about the homeopathic management, I would definitely encourage all of you, my younger homeopaths, to go with the natural measures also. Let us be integrated homeopath, where we help the patient, not just with the homeopathic medicine, which is good, but also with some general measures that would be helpful for the patient. So we should, I normally encourage my patients to go in for steam inhalation and the neti pot usage, or if that is not available, just use a syringe to irrigate the nasal passages with 2 cups of boiled cooled water with a half a teaspoon of baking soda and a half a teaspoon of non-iodized salt. And even warm compresses also help in relieving the congestion of the sinuses. And invariably, during that time, rest is very important. Now, the diet, I also give much importance to the part of diet where I encourage my patients to increase the intake of warm water. I've got a general habit, I don't know whether it is good or bad, and I try my best to practice that, trying to start the day with at least 3 to 4 glasses of warm water. So I keep telling all my patients, irrespective of patients with sinusitis or anyone, any problem they come, that is the first thing that they say. So if I've got an assistant, that'll be the first thing that they will be able to tell it. So increasing the intake of warm water during sinusitis definitely would help relieve the sinus congestion. And the other thing which I would want to point is to reduce or stop the dairy products completely, especially the cow's milk, because it's the naturopaths say and the Ayurvedic doctors say cow's milk can increase the mucus secretion, which is very true and which has been seen. So I advise them to reduce that or stop it completely. And I also encourage them to take the natural homemade grandmother's remedies like the turmeric, honey, lime, and garlic in a paste or as a drink. Now let's come to the case which I would want you to go along with me. This, as I said, this was the first case which I got in 2008, and one of the cases which really helped me put my footing into my practice in Australia. So this was a complaint of sinusitis. She had the frontal sinusitis, which keeps recurring since 20 years of time. When she came to me, she had very bad, severe sinus pains and coryza, thick coryza, and postnasal drip, which she said was aggravated in the morning before storm and cloudy, rainy days with humidity, and even the glare of light also used to make it worse. Now she had that bad offensive breath, and she complained of blurry dimness of vision when she gets exposed to sun. Now, the most so all these features which were there are mostly there in all the sinusitis symptoms. Something which really struck in this particular case with me was the sensation of the electric shock, shocks across her head, which gives her a vertigo and occasionally nausea. And this comes most of the time once a week with very bad photophobia. And she gets migraines also at times with this nausea. Now, within a urogenital system, she had the tendency for recurrent urinary tract infection. And the last episode was 2 weeks back, where she came with a severe lower abdomen pain and accompanying pain, frequent and with burning and a drawing pain. Now, her respiratory system, she had cough, she had difficulty of breathing, and it was winter here, so it was winter in Australia at that time, so she was really down under the weather, and she said that she only feels better for a respiratory system only in the summertime, and she has history of pneumonia and pleurisy. She was being prescribed with Ventolin, which relieves all her complaints of the breathlessness. Now, her general features were she was really tired. She said most of the time she pushes herself out of the bed to work because she enjoyed her work, though she was tired, and she used to work hard and tried to be kind and perfect in her job. She was working in the same clinic that I was practicing. She was working as a medical receptionist in that one of the busy medical centers where I also happened to open up my homeopathic practice. And on most of the days, she feels like she has to sleep in and sleep for a longer time, but that doesn't happen because of her work and the travel that she had to make every day. Her past history, when I checked, was she had an adenoidectomy and tonsillectomy 7 years of age. And you see what happens afterwards. Though adenoids and tonsils aren't required, when that is being taken out, other areas of the passage, the sinuses get involved. Now she had cancer breast, left breast had a carcinoma, where there were 2 lumps which were excised off when she was 40 years of age. She had genital herpes in 2007, and she had syphilis in 1976. mind you, this case is in 2008. Now, she had a laminectomy done for a LVDP in 1984, and she had an excision of a part of a left cheek because of the basal cell carcinoma, which was detected. And she had a bout of depression. She went through a phase of depression, which I would be discussing at a later stage. Now, her family history, her father is no more. He was an alcoholic, and mother has arthritis. She's alive, and renal issues. Her brother and her sister have mental issues. Now, the physical generals, which I've found out where her appetite is generally good. She eats a healthy amount of food, but her appetite, she eats very little, but she says she's got a good appetite and she enjoys her food. Now, thirst, she drinks less generally, but whenever she drinks, she enjoys drinking warm water. And her cravings were for dark chocolate, warm food, roasted lamb, olives, and hot, spicy, salty food. She said she is averse to rabbit meat, liver, kidney. And the addictions she said was she takes about red wine 5 times in a week and occasional beer. And her bowels, she had very difficult bowel movement with a sheep dung sort of a consistency of the bowels. Her urination was burning and she had the incontinence and an increased frequency. Thermally, she says, though her complaints are bad during winter, she prefers the winter for general feelings. So thermally, she's a hot person, and her sleep gets restless with the urination that she keeps, for which she has to keep getting up with the burning feeling that she gets. And she gets disturbed with fearful dreams. She perspires on her forehead and axilla, though it is less in quantity. Now, her menstrual history, she had her first menstrual period when she was 12 years of age, used to be regular for 5 days with moderate quantity, as well as with clots, and the cycle used to be 28 days. She had, I haven't mentioned that, she had fallen pregnant twice, and her complaints of abdomen pain during the periods was not that significant. She had leukorrhea, which was a moderate in amount. Her sexual functioning was satisfactory. She says that she used to have it 2 to 3 times in a week. And she mentioned about her stressful incidences that had happened in her sexual relationships when she was 5 years of age and when she was 18 years of age. When I say 5 years, I'll come to that at a later stage in a life space. Yeah. Now, her mental generals. Now, as I said, there was a history of sexual abuse from a childhood, from about 5 years of age to up to 13 years of age. So she had a lot of suppressed emotions and suppressed modifications. And also, she mentioned that at 18 years of age, she had a very stressful married life from whom she had to get divorced after 18 years back. So even at 18 years of the age of her age, she had the first relationship, which also was a catastrophe. So she had been a person who had been having all this history of abuses and mishaps in the relationships and married life, and she was a person who was just at one time of her life, she forsake her children because of all this marital disharmony that was happening. And for some period, she had been she had lost all contacts with her children. And all this had brought up nature in her, which which I've mentioned it as, she's quite adamant in getting things in her way. Now she's got a partner now. He's a very loving guy, but he, even with him, she doesn't get herself to that open, because she, with all what she had experienced in the past from her young age up to 18 years back. Um, Now, so she's become a fastidious person. She tries to find, sort of a relief of her complaints and a thought process by doing her work to the best of her ability, and getting that getting that appreciation from her boss. And she says that she does like her work and she does it very perfectly. And that sort of a perfectionism also had been reflected in her family life, with her partner that she has now, that she dictates certain way of keeping her, keeping the situations and the house in a particular order. Also, another characteristic which she was telling was, she wants a husband, oh sorry, a partner, just around her, not to be anywhere close to her. She doesn't want any much of hugs and all that, but she wants him around. And otherwise she feels a bit of an insecurity feeling. So I've just erected a chronic totality. Before that, we'll just have a quick look on the acute totality that I've erected, which is the left-sided pain, headache, aggravated in the morning, aggravated in the night, with light, aggravated stooping, and also aggravated with any misstep. And she says about that electric shock, sensation of that electric shock across her head, which is very much a neuralgic pain, photophobia, and the postnasal drip and the vertigo. These were the symptoms that I took for erecting this acute totality. Now, when we come to the chronic totality, as we were saying, the fastidious nature was so marked with her insecurity. And she had that history of forsaking her children. Though she's come back to her children now, her son keeps blaming about her, doing that at that time when he needed her the most. She is a perfectionist. She got evolved into becoming a perfectionist to get the appreciation of her boss and appreciation of her colleagues. She she said that she suppresses her emotions and tries to put up a happy mask when she is outside, when she's outside with her workmates and in the society. She said that she was physically and emotionally fatigued. She was very sad. And her cravings were, as we had mentioned earlier, chocolate, warm food, warm drinks. Appetite was reasonably good. Thirst was for warm water. Now, the repertorial status, with a complete repertory that I used, I came up with lycopodium as the 3-mark remedy, and just immediately followed by Nat Mure and China. We could see Nat Mure very much in this case. I was on the impression that we'll go with Nat Mure because of the suppressed modifications and her putting up a figure outside, and also giving a happy look. What do you call a hidden mask that she had put to hide her emotions. So saying that I was thinking of Nat Mure, but seeing the marks that was there, I started off with lycopodium, and these are the other remedies that came up: Nat Mure, China, sulfur, sepia, and phosphorus. Now, the first prescription that I gave according to that acute totality was Spigelia, because with her intensity of her complaint, I was not in the, I thought it's better to start off with an acute prescription than to go with a chronic constitutional totality. So I started with Spigelia 200C, which was asked to be taken 3 hourly initially. Once she's 30% better, to make it 6 hourly, and once she's 60% better, to make it twice daily, and once she's 90% better, to stop taking the medicine. So so this case was taken, and the first prescription was given on the 29th of March 2008. January, February, March, yes, 29th of March. And I requested her to come back on the 19th of April 2008. She said that she had been feeling well with the remedy, but she got reinfected with congestion of sinuses, sore throat, sensation of the tightness of the chest with sinusitis, and the pain leading, going to the gum, and with a feeling of a teeth pain in the past 2 days. Now, with the urinary tract, which she had, she said it was very similar, but it wasn't of that intensity. But she's found a little bit of relief, but it was same. And the tiredness was less than before. So she said now she's got a feverish feeling, and also her abdomen was bloated, and she had a hard bowels in the past days as well. So that hadn't been helped with spigelia. So I thought I'll start off the constitutional remedy, and I gave lycopodium, which was to be taken bedtime and the next day morning on a 4 days gap. And I also asked her to keep the spigelia that I gave to be taken if required, but before taking, to report to me before taking it, so that I could know what lycopodium is doing that up till then, and how we need to go about. But lucky enough, on the 10th of May, that is about 1 month after, she comes back saying that she was feeling 70% improved generally, and for the complaints, only one attack of sinusitis in the last 2 weeks, but she could manage without anything. I had encouraged her to do that neti pot, as well as to do the sinus steam inhalation, which also helped her. So she didn't take the spigelia for that time. And she said that after starting with lycopodium, her energy levels had also increased. Now, so I asked her to come after 1 week, after 14 days, and asked her to come on the 24th, just to make sure that everything is going well. It so happened that on the time that she came, she said that she was 75% better for the complaints, but the genital herpes that she had, that appeared 1 year back, has reappeared, and it was really bad. Like she was having severe pain and severe tingling, and she said it was 8 out of 10. The scale, out of a scale of 10, she was suffering 8. So at that time, I asked her to take lycopodium, same way, bedtime and the next day morning, on a 6 days gap, not on a 4 days gap. I asked her to do, increase the gap, and I asked her to take 1 dose of Merxol to be taken once a month, but the first remedy that I gave that day was a dose of Merxol to be taken at bedtime. And I'd asked her to repeat it after 1 month, and to take lycopodium on a 6 days gap. Now, on the 24th of 7, then after 2 months, that is in July, she comes and she says that she was feeling well. In fact, there should have been a appointment around after 1 month in June 2008. But since she was feeling better, she said she will just call it off, and she will come after 1 more month to see how things are going. She was quite happy. So she said, and also coming every time to meet me, incurs a cost for consultation. And the system here in Australia is, if you can go any number of times to a conventional medical doctor, to a general practitioner, you don't have to pay. Would be taken off from the Medicare. But if you come to a homeopath, you will have to pay it out of your pocket. And though there were a little bit of reimbursement from the private health fund if you have. And if you don't have a private health fund, you would not be able to avail that also. So most of the time, that is something which I've noticed. Once the patients feel better, they try their best to avoid the consecutive or the scheduled follow up after 1 month. And so this particular patient reports after 2 months in July on the 24th, and she says she feels well, and the energy levels had been good as it had been earlier, had already been improved, and the good thing is her herpes, genital herpes, which was 8 out of 10, had come fine, had come 0 out of 10. She said she didn't have any tingling, no pain, no irritation going to the toilet. Her urinary tract infection, which she had, also hadn't happened in the last 2 months. Same with sinusitis. She was quite happy, and she said she would be more than happy to introduce me to her, patients. She, being a medical receptionist, she started just, broadcasting my treatment to most of the patients who come there and who were finding it not being benefited out of conventional medicine. So through her, even one of the doctors there also started, getting an interest in me in homeopathic medicine, and he used to, not regularly, but he used to send some cases of sinusitis, chronic infections, and chronic fatigue syndromes, also warts and other skin issues also. So this case was one of the cases which really helped me, and this is the testimonial she gave by the end of the treatment. And it would be there. It is there on my website as well. So I would not want to waste my time. And yeah, so this is something which I would want to highlight, or to say that the best way to go about is getting the constitution of the person. Try to treat constitutionally. If you can get the miasm, it is very good. Keep all that ready, like, keep all the anti-miasmatic, just like how you have been taught at college. Your teachers would have taught you that, like, erecting the totality, the constitutional, the acute totalities, as well as the miasmatic totality. Keep it ready so that whenever required, you could take it and use it. And without much of a delay, you can get the results in this competitive world of medicine. With that, I would like to thank you. And this is my website. You could just have a look if you're interested. And my phone number is down there. And with that, I've come to the end of it. Manish, would you like to take up?
Yes, so sir, I think for like, can we take sir 6 to 7 questions for 5 to 10 minutes, sir?
Yeah, sure, definitely.
So
I'll try my best to help you.
yes, so the participants who are watching us now, they have any questions or any doubt, they can put in Zoom chat box, and the participants who are watching us in YouTube, they can put their questions in YouTube chat box. Favor, can you just go through the YouTube chat box and bring that questions to sir?
So there is one question: which potency works here, and what about the repetition? Well, the potency which I normally give on acutes are um, mainly 200 or sometimes 30. So that is the potency that I use for acute situations, and I've seen quite good results with it. In constitutional therapy, where there is a structural sort of involvement, where the sinuses are quite inflamed, and when she said about the 20 years of the duration of a complaint, I thought, let's go from the lower potency, and the potency that I had at that time, which was 30. So I started off with 30C, and then as the effect of the 30C sort of dies down, it's all just like how I've been taught in my college days. Once the potency of the 30 potency, or whichever potency you've used dies down, let's go up, step it up to the next potency. How do I choose the dosage and duration? Well, that is from practice. I've seen for acute complaints, frequent repetitions are good. And also, in some cases, if there is fever and if there is, where there is more of an active infective process happening, I start off with even 1 hour repetitions of the acute remedy. And from there, we go in for making it from 1 hour to 2 hours or 3 hours in accordance. In this particular case, I saw that intensity would be sort of helped with a 3-hourly repetition, and then graded to gradually to be gone to 6-hourly repetition. Now, the other one, remedy for fungal sinusitis, please suggest. See, we again, we are not doing a tautopathy. We are doing a homeopathic type of treatment. So in fungal infections, in fungal sinusitis, I would say the best way to start off would be giving an anti-miasmatic remedy. Basilinum or tabov would be a few of the best remedies that we can start off. And then we could go in for the symptom totality of the case, of the presenting complaint of that particular patient. And I believe that should help. How to treat pansinusitis? Whatever, as you would be knowing, whatever be the name, our method of treatment would be getting the totality of the case. And the symptom similarity, as we said earlier, in acute presentation of the sinusitis, we don't go just with the terminology or just with the common symptoms. We should find out the sensations and the characteristic features that mark that particular patient out of another patient. So that is something which we should be looking at. Can it reoccur after treatment? And if happen, can take the same medicine as earlier used? Yes, we can take the same medicine. We can try giving the same medicine which helped earlier. And if it doesn't help, and that is where again we'll have to see whether we need to get an acute retake the acute totality, or we need to resort to basilinum or taboo. Basilinum or taboo had been also of great help in in fungal or in certain types of sinusitis which have come up, where there is a more involvement of the lung as well, but there is a bit more of breathlessness and difficulty in breathing. Herpes, which reappeared after medication is cured with the next medication. Look, the herpes which reappeared, yeah. So that is when I went for the constitutional treatment, and that I believe that would have been helpful. Maybe even again the constitutional, as I said, every homeopath would have a different way of finding the constitutional treatment, constitutional remedy. So the constitutional remedy which I found in this case was just lycopodium, and all that the amassing of all that names, and I would say even the remedies that the 6 or 8 remedies that I put in the acute sinusitis therapeutics isn't a full-on one, isn't complete, because there are quite a good number of other effective arsenic album, aconite. There are other acute belladonna, acute remedies which could be helpful, but these were the remedies which had been found effective in my consultation, and which I've found in my case records when I look back, and that's how that was formed. Thank you for that, for saying that the session was really helpful. Hope it had helped some people. So, sir, please guide basilinum potency. 15 and 15 days repetition require or not for severe fungal growth. The basilinum potency, I normally start even with that as well, with 30C. Step it up. I don't repeat it that often. I repeated only once in a week initially, and then and gradually making it into 15 days. In this particular case that I shared, I gave the milk sole, another remedy which I've seen very effective for sinusitis. I gave milk sole only once a month, just to get that syphilitic taint, whatever is there, with the history of the carcinoma, with the past history of carcinoma and the history of the genital herpes, syphilis, all that there, and also the chronic infective sinusitis. I gave Merck sole, but again, that was only to be taken once a month. So I believe Basilinum is better to be taken once a week initially, and then maybe on a fortnightly. Thank you, sir. If bones of nose increase or change shape of nose, which medicine is preferred, preferably should be used to avoid operation? That is a good question. First of all, we need to, again, we need to see the totality of the case and see, we need to correct the infection, what is happening. So the totality, again, is what is required. And I would say Merck salt is a good remedy. Again, when there is the bone or the nose, there's that shape, there's a change of the shape, or there is a disintegration of the bones. Merck salt, mercurochrome, fluoric acid, nitric acid, all of that come. I would, before closing, I would like to share this particular case, which was where I gave fluoric acid about 2 months back. That person came in for a complaint of depression, and I was trying my best to help him with different remedies. I gave him fluoric acid. He said, no, there's not much of a result. Why I gave was, he was a person, he was an unmarried person, but at the same time, whenever he gets stressful, he likes to have intercourse with anyone and everyone around, and he doesn't like going to the same brothel or the same prostitute the second time. So he keeps changing, the ladies and prostitutes, and also he tries to hook anyone around if he can. He's got a good build, he's very handsome, but he's got depression. So this particular lifestyle brought him to that sort of a depressive state. He said, I can't trust anyone, and I don't like anyone, but this is the way that I relieve my stress, by having intercourse and sexual intercourse, and I like to have it with different people. So with that, I had fluoric acid in my mind, and I tried giving that. It didn't help him much. He said, oh, Sam, that doesn't help me. It didn't help me. Mate, I had to go for antidepressants. But he came for sinusitis once. He happens, and he had a lung involvement as well. He had some bit of bronchitis as well. So I gave fluoric acid at that time, once again, because of his state and seeing that fluoric acid can be helpful. And lo and behold, he became totally better for that. But that, and then he hasn't reported yet. I was on the plan of increasing the potency of fluoric acid and trying to give him once again for his emotional state, but he never reported back. But he called me and said that he felt better for the sinusitis. The sinusitis got completely better, like cured or completely better, but then he haven't had him back for another appointment.
Hello, sir. Hello.
Yes. Yes, Manish.
We are running out of time, sir. Can we take one last question, sir?
Yes, sure. So
Sir,
what do you want me to answer?
What is the time duration to decrease the size of adenoid or tonsils to prevent adenotonsillectomy?
Again, that is, as you would know, it depends upon the receptivity and susceptibility of the person. From what I've seen is, it takes at least 6 months in my practice to really bring the tonsils or the adenoids back to a place that they would say that is fine. You don't need to have a tonsillectomy. And iodine, as I mentioned, iodine and baryta carb and baryta mur, baryta iode, calcarea phos had all been found very effective for that. But it would take, mainly depends upon the receptivity of the person. But I've seen it takes about 6 months.
Okay, sir. So, sir, like if you permit, sir, can we conclude the session now?
Sure. Thank you, Manish. Thanks for organizing this and giving me this opportunity to share what I have experienced and just in my limited experience to share the information that I had. And thank you to all of you guys who were behind this particular webinar. And you guys are doing a great job. I would have to commend the Students' Union for taking up this initiative to impart this knowledge into fellow homeopaths, because this is a time that everybody is at home. Most of you guys would be at home, and this is the time that you can sit and study as well. So all this, tips that every homeopath who has been there in the past, with the presentations and who are there going to be coming further, it is going to be helping you. And I really appreciate you guys for taking up this opportunity and making use of this time. Thank you once again.
Yes, sir. Faber, you can take over the vote of thanks. Over to you, Faber.
Here we come to the end of the 23rd session of the Clinical Webinar Diaries. I express our heartfelt gratitude to today's speaker, Dr. Punnoose Sam. Despite the time zone difference, Sir has gracefully taken an enlightening session on homeopathic management of sinusitis. Sir, today you have not only imparted knowledge to us, but also inspire the young budding homeopaths like us. Thank you, sir, for gracing us with your presence. I also thank Dr. Praveen Raj, the principal of Alva's Homeopathic Medical College, for inaugurating today's session. I also extend our gratitude to all the faculty members of the college as well. Last but not the least, I thank all our diligent and enthusiastic participants. Nothing but gratitude to all, and good night, everyone.
Thank you. Good night.
Thank you, sir. Good night, sir.
Good night. Thank you.